way, how diverse professionally our speakers are tonight, because I believe this is the first time we have a physical therapist. Show of hands, how many physical therapy students in the room? That is great. That's great. I have a lot of respect for all the professions represented here tonight, but since my father had a stroke at age 92 last September, I have immense regard and am grateful to the physical therapists who took care of him and believed in him and got him up and walking. So thank you. So now we're going to hear from Casey Nesbit, assistant professor in the graduate program in physical therapy at the joint UCSF San Francisco State University Doctor of Physical Therapy program. She received her Bachelor of Science in Physical Therapy from Virginia Commonwealth University, Master of Science and Doctor of Science in Rehabilitation Sciences, from the University of Oklahoma Health Sciences Center, and Doctor of Physical Therapy from Marymount University. She's a board-certified pediatric clinical specialist with 35 years of experience. Currently, she practices at UCSF Mission Bay Children's Hospital. Her clinical experience includes part-time work over the past 14 years in Malawi, Africa. There, she is a member of a primary care team with doctors, nurses, and community health workers. Her research interests include valuation of disability in developing countries, health equity, clinical reasoning, and effectiveness of training programs in the developing world. When she's not working, she likes to run mountain trails and play with her grandchildren. Welcome, Casey Nesbit.
Thank you guys for inviting me to be here and share stories about trust. I think by definition here, we're gathered in close proximity and we're come here together with a common passion for primary care. And we've created a real safe space here for sharing our stories. So thank you all for being somewhat vulnerable as we stand here and share our stories. But that makes us neighbors, right, by definition. And even if as I've sat here close to my neighbor, I feel like we have built a connection somewhat through this conversation. So I appreciate that. So I'd like to talk to you about trust and neighbors. I'll have to go back a little bit to Miss B, who was my neighbor growing up. I put her name on my emergency card when I was a student at school every year. I fed her dog when she was on vacation, brought in her newspapers. She even had one of those safe home symbols that was in her window, so everybody knew she could be trusted. My kids grew up in a small town in Virginia that was a National Historic Landmark. The houses were built in the 1800s. They were in close proximity. Old people, young people, mixed generations inside. It was the kind of town where people rang the dinner bell to bring their kids in at the end of the day. They trusted their neighbors too. But it wasn't until I started working in Malawi that I realized how trust impacts where people seek care when they're sick. Right? I went there first in 2006 with my then 16-year-old daughter. She wanted to volunteer in a hospital, and she was also considering becoming a doctor for the underserved. She became one, by the way. Grew up here at UCSF Medical School and pediatric residency. But anyhow, we got to know this community in Malawi that was served by this rural referral hospital, 250,000 people, spread out over a 30-mile radius. No physical therapist there ever, but there were a lot of people that needed rehabilitation care, so we were busy. We met patients, and we met their caregivers. In Malawi, when you come to the hospital, you come with a caregiver, and that's the person that makes sure you take your medicines, believe it or not, because they're just placed at your bedside, the person that changes your linens, the person that helps you with your daily care, and the person who cooks your food, because the hospital doesn't provide. They often come to that hospital weary. of the care that they're receiving in a Western hospital setting. And it does take time for that skepticism to be replaced by trust in our care. The other people that I met when I was at the hospital that first year were community health workers. These are people that provide care for patients in the villages. And sometimes they were at the hospital because they had brought a patient there, transported a patient there, and sometimes they were there serving as that patient's caregiver. They were also there watching us. I can remember specifically us helping a man who had a stroke start to begin to use his arm again. And the community health worker approaching us saying that he had a neighbor in his village that couldn't use his arm either, and he thought this would help him. Could he learn? So we taught him, and I'm sure he went back and imparted that knowledge to his neighbor. So I've continued to go back to the same hospital since 2006, at least once a year, and I do provide physical therapy services, but the most important thing I feel I do is train those community health workers. There are 60 of them now who have had intensive training in rehabilitation, and I've also started training them to do things like monitor blood pressure for patients who are on medication for hypertension and congestive heart failure. So these community health workers are volunteers chosen by the hospital, but only after being recommended by the village chiefs and elders, because they need to be trusted in their community. These are community health workers who work alongside each other, who work alongside their village people. They share food, they build houses together, they care for each other's children. And they're all embedded in this Chewa culture that has a strong sense of others. It's a non-confrontational society, non-competitive, and community-minded. So there's Binali-san. He's a community health worker in the town, in the village of Nyanja. Nyanja is about 6 miles from the hospital via dirt road. Binali-san owns a bicycle, which is a real nice commodity. But he's just a sustenance farmer. He provides for his elderly parents and his growing family. And he also cares voluntarily for 7 patients in his village. 4 who have had a stroke, 1 who has hypertension, 1 with diabetes, and 1 with AIDS. So he's built bamboo parallel bars without me telling him about what parallel bars are. He built them for patients to practice walking. He's modified steps that go up to a patient's home to make them into a ramp by just using mud bricks so that a patient can be safe as they travel in and out of their homes. He's taken the knowledge that he's gained in his rehabilitation training and trained every single one of those families so that they can be empowered as well. And when the man who is taking his blood pressure medication and feels good and wants to stop taking that medication because he's better now, Binali-san is right there next to him in his village to explain the importance of taking his medication daily. When someone wants to participate in some of the traditional medicine practices like laying on a mat without doing any activity, he's there to explain how important activity is for their rehabilitation. And when the elder person wakes up that morning, has slurred speech, and can't raise one of his arms, Binali-san is there to encourage him to get to the hospital because he's trained to recognize the signs of stroke. When his other patient doesn't come to clinic to pick up her medications, the hospital texts Binali-san to follow up and gets him on the ball to get a family member to go pick up that medication. Okay? So I learned a lot about trust building from Binali-san. Not only about providing care, but about being at that front line on the doorsteps of the people that you care for. And I think of him when I imagine what it would be like if we cared more for our neighbors. And I think of him when I think what it would be like if we could build that better trust with our patients. I think of him when I have a patient who doesn't trust. And I think how I should think about figuratively putting myself at their doorsteps so I can better understand. And I think of him when I think about how we could better care for people in their communities so that we are the ones that accommodate for ways in which they are comfortable. So I've learned a lot from Benali's son, and he still has a lot more to teach me, but I'm humbled by the way he uses trust to provide primary care. So, thank you.
And yeah, so I think, this idea of neighbors is a very interesting one to me, because I have this experience every day when I go to work in the Tenderloin of not living a life that is anyway remotely close to the lives of the people who are there when I leave at night and are still there in the morning when I come back. And how our profession, or professions, can take us away, right? I mean, there's, the myth, or not so much myth, I guess there's the ideal of the country doctor, or the family doctor, or whatever type of professional that's embedded in the community, and our work takes us away from that. And sometimes it can be very disruptive and disturbing to kind of see that, to go back and enter in and out of that space. And so so how do we keep connected to the people around us? And understandably, we need to have lives that are outside of our profession. And at the same time, the people that are in those neighborhoods need us, but don't necessarily want us to, patronize them or pity them. And I think it's really special when you can have someone who can know just how to connect with somebody, because it's not easy. And I think from my perspective, the reason why a lot of people don't, especially in positions like the people you were taking care of, don't trust, is because they've seen people like us come and go, right? And don't really know how long we're going to be around, and they don't get to leave. So, just thinking about the privilege that you have to be able to enter and exit a space like that, and where the people you're caring for don't. So thank you. All right, let me go get some more Post-it notes.